And now a few words about today's speaker. Dr. Marin has been a member of the Mount Sinai faculty since 1992. She's board certified in both psychiatry and neurology. As an expert in geriatric psychiatry with special knowledge of Alzheimer's disease, Dr. Marin receives patient referrals from physicians locally and nationally and has played a significant role in clinical research studies of dementia. She has held a broad range of leadership roles in the Department of Psychiatry at Mount Sinai, including Chief, Division of Geriatric Psychiatry, Director, Geriatric Psychiatry Fellowship Program, Medical Director, and Vice Chair for Education. On the institutional level, she has served as the Executive Vice President for Strategic Development and Chief Medical Officer of the Mount Sinai Hospital. She's now, among many other things, the Director of the Center for Spirituality and Health and a leading voice in the fields of spirituality and health and professional healthcare chaplaincy. This morning we're delighted to have her with us to talk about the work of the center over the last year in this administrative grand rounds presentation. So, ladies and gentlemen, Dr. Deborah Marin.
Thank you so much, David, for that very kind introduction. Not necessary. Good morning, everybody. I know most of you, I'll meet some of you who are new, I know, to our center. So this is actually our first administrative grand rounds of the center because our center became a center 10 months ago. So for some of you already know what our vision is, but just to review, the purpose of the center is to have a medical school-based but system-wide approach to the following issues, which would be clinical services, education, community engagement, research, staff care, and operations. I'll focus on the first 5 issues today to show you what we've accomplished, thanks to a terrific group of people who are in this room. So we had our first meeting with our senior leadership for this system actually in June, and since that time, only like 120 days at most, we have acquired an on-call system, which is very important for patient care and also to help our chaplains not feel as pressured as they need to be on call, but we need to have people available 24/7. I think it's critical for our patients to have that. We have development of postmortem policies for different religions. We have the standard education curriculum actually started in the past year, and I want to thank David for that, and also Joe and Nathan. And a big deal for our other hospitals is we'll be able now to have documentation in PRISM EHR, so we're able to share data with one another, something we've not been able to do about the work that we're doing. Okay, let's start with clinical services. So our new leadership, I'm doing this in chronological order of how things occurred. Rabbi Joe Hirschman, I believe first week of May, became the clinical director of Department of Spiritual Care at MSBI. Reverend Dr. Zarina Costello was promoted to be director of community engagement for the center, for the whole system. And Rabbi Daniel Coleman has been with us for not yet 2 weeks, correct? And he comes from Northwell, and he's our director for here, Mount Sinai Hospital. I want Rocky Walker, one of our residents, is now a staff chaplain at MSW and SL. So now, so beyond that, I would now like to go through what I look at, and we all should look at, to determine the work of our center. So this slide refers to what our staff is doing. This is just Mount Sinai Hospital. We don't have this kind of data from the other sites yet. But what it shows, if you look at, hold on one second. Just hold on a second. So, there. What I want you to notice is that our group of chaplains and residents and interns in just 8 months at Mount Sinai have seen 12,000 visits of patients. That does not include our volunteers, which probably is another 6,000, 5,000. So we are a very, very busy department, and we are recognized as being such. And that is a very, very big deal. Okay. So I look at this data because it's important for us to impress upon other folks at Mount Sinai that we serve our patients. And as you can see, everybody's busy. These are the staff chaplains, these are the residents, and these are our interns. This is a comparison. We just started receiving data from MSW and SL, from Meredith and her group, starting in April. But what I want you to see is that, not unexpectedly so, Mount Sinai, we tend to have a lot more data. The bar graph is for every month is followed by MSH and the MSL and MSW sites. And you can see we do a lot of work with patients. And we do a lot of work with other folks as well, not unexpectedly. So particularly for the very seriously ill, where the patients cannot have their own voice, we work with the families, correct? So you can see here we have lower volume from MSW and MSL, but that's reasonable because we have a lot more manpower. So what I look at here, though, again, interestingly enough, and this is consistent with the literature, a lot of the work that chaplains do is with others than the patient. You can see that percentage. It's very important to document this because in hospitals, a lot of the patient experience is really what the families experience, taking care of their needs. So referral sources. The reason this is very important is that I am a firm believer in George Hansdale, who has helped me a lot through development and continuation of the center, is it's very important to round with purpose, but I really want to see that our center is viewed as a resource by others who work in the hospital. And what's important to note here is that this is rounding with purpose, but this is nursing referrals. That's extremely important because they really are the ones who are going to refer to us. We know they'll be followed by doctors and social workers, but the nature of the game right now is the nurses are the ones who are always on the floors. Doctors come in and out, social workers come in and out, chaplains come in and out, but the nurses are always there. So we are in the mind of the nurses. We're doing a very good job. And we need to work on that at our other sites as well. I think there's a growth of that, but Meredith's been doing this only for a little over a year, and it takes time to build that up. What we have done here, just for you to know, for those who weren't aware, we actually did a process improvement plan, and we wanted to understand how nurses like to refer to us. We learned was that at Mount Sinai, they actually like to use the, it's called Am I On, like Am I On system, to get a hold of chaplains. So what we've done at this site is we've developed many avenues through which nurses can get a hold of us. The days of interdisciplinary rounds are kind of over in that they usually have discharge rounds. So we need other methods for people to get a hold of us. And that's what we've done quite a good job here, and I'm sure we're able to do that in the hospital system as well. Okay. So now I'm just going to go through the accomplishments by each of the sites. This year has been a transition as of March, and I really want to thank Serena Costello for really doing a banner job and passing on the baton to Daniel now. And in spite of the transition, what has occurred is that Serena was really on top of organizing our volunteer program in a way that we can better understand what they do and how they do it. Training youth rigorous ministers, I want to thank Rick Bauer for that. It's extremely important. We have a very high percentage of Catholic folks who come to this hospital. And also, through the work of Maggie Keogh, we are now integrated into a respiratory failure pathway, which, for those who don't know, is very important because that's a junction in time for patients or families at which we know patients may not do well at all, and a change in course of treatment may be critical. And I think a chaplain's involvement in family meetings can be very helpful for the issues at large, spiritually and regarding medical decision making. At MSW and SL, under leadership of Meredith Lissagore, we have now a prison template so we can enter data. We're able to follow that. We have inclusion. Again, I think it's important for chaplains to be involved critically in critical points in care. And Meredith's arranged to have chaplains included in the fetal demise and stillbirth protocols of a very large OB program at West. And we have improved coverage of priests. Again, a large percentage of folks who come to, particularly, I think, Mount Sinai West and St. Luke's are Catholic. And we also now have a very important contribution of Meredith to monthly reflective rounds for cancer patients. It's very stressful to take care of these patients, and Meredith is now a part of those rounds. It's part of staff care. Also, Meredith has arranged for weekly spiritual meditation groups for nursing support, and the chaplains are, as I mentioned before. At MSBI, Joe's only been there a short period of time, but that hospital is going through a change from inpatient to outpatient, a major sea change for a major hospital in New York. And through working with leadership at MSBI, Joe has arranged to have ongoing spiritual care for patients who go to the cancer center, an addition of spiritual care services, in the HIV services, addition of a spirituality group, and also for geriatric patients. That hospital is transitioning to being primarily outpatient. In addition, Joe is involved in the Center for Transgender Medicine and Surgery. For those who don't know, we are a hub in the tri-state, if not Eastern Seaboard area, for transgender surgery and care. Correct, Joe? Am I correct in stating that? Okay. And she actually has put in for, hopefully, acceptance to a meeting, a case series that has been done through working with those folks. Education. Under the directorship of David Fleener, I want to thank him for his work this past year. He's only been here also about 14 months. We have we have Rabbi Ariel Goldberg, who has been a resident with us and a fellow with us, and now he's going to be a supervisory education student at MSBI. I want to welcome our new residents. They are quite accomplished. You can see their backgrounds from, you can see for Rick Bauer, he has actually experience around the globe in terms of palliative care for the underserved. We have Mr. Johnny Klein, who comes from an MDiv from Chicago Theological Seminary just a year ago. Ms. Karen Terry, who is a graduate from Harvard Divinity School. Reverend Rachel Cheney Todman, am I pronouncing that correctly? Chinny or Chinny? Shinnery, excuse me, Shinnery, sorry, who comes from Fordham University. And a part of education, Rabbi Rachel Van Thin, who comes from Jewish Institute of Religion, Reverend April Stace, who comes from education-wise Catholic University of America, and Ms. Iman Zaran, who has a graduate certificate from Harvard Seminary in 2016. This is a quite amazing group of residents. We welcome you. I hope they get to know you better. In terms of education, this is an example of our expansion. It's highly unusual for a Department of Spiritual Education, let alone a center, to have CME grand rounds. And we've had a remarkable group of guest speakers, and we will continue to do so. It's very important because it validates A, what we're doing, and B, it gives you the opportunity to learn state-of-the-art information. And social work now is part of this rounds too, which we welcome them. Through the work with medical school, we are co-sponsor for an upcoming Islamophobia symposium, which will be extremely important for this place. And in addition to what you're going to see tonight, we've actually had 2 times now films, correct, which have been shown here as the hub, with the folks who produce it being here to teach. Our residency, through the work that, as I mentioned, Joe and Nathan and David, we have a research literacy curriculum. We have a grant from the Templeton Foundation, highly prestigious, highly competitive. I think they really recognize us, that we are on the forefront of how education should be. We have a new CP residency curriculum that includes research, journal club, and also now the opportunity to work with senior leadership. We're aligning the curriculum with core competencies of chaplaincy and our expansion of our preceptor program. I want to thank all of our staff chaplains who've done a really great job in working with us on this. Community engagement. This started about 14 months ago as well, 13 months ago. So starting actually years ago, we started having monthly breakfasts, which Raphael Goldstein started. It's been 6 or 7 years now. And we recognized from those breakfasts that the community really wanted us to go out to them. Those breakfasts are important to teach about health prevention, education, disease management. They learn about research. It's a wonderful opportunity. But in order to really get out to the community, you have to get out to the community. And Serena Costello has done this. So it is called the MultiFaith Initiative on Community and Health, or MICA. We're in the process of getting it branded, actually, for the work that she's done. It provides health education outside in the congregations as per what they want. Each congregation, as you probably know, is different. We are interested in improving access to health care. We have some data to show that. And also, we're very interested in preventive care because really, people don't usually come to doctors. They actually go more for the church probably than they come to doctors. So it's very important to get into that faith-based congregation to do that. And it's really due to Serena's ability to collaborate with a lot of partners in our system to get people out there to help us. So this is a very busy slide. I just want to point out to you that Serena has been involved in 98 different events in the past 14 months. One person. And due to our collaboration with the Division of Oncological Sciences, you can see these breast screens and cervical and colon. Over 200 people have had access to screening through a research program that we're in collaboration with. And this is free for people who normally may not get treated. Okay. She has socialized us, almost 6,500 people. That is how you get the word out. That's how the community can get to recognize. So this is tremendous information regarding what can be done. The next step of this is determine outcomes. Aside from the cancer screening, we don't know what happens next, and that's what we're working on. Okay. And in addition, for those who don't know, there's something called the Delivery System Reform Incentive Payment, or DSRIP. It is a national and local Medicaid level idea to try to improve the health of Medicaid recipients, and Zarina is part of the 2 committees, correct? And 4 committees now, excuse me. And what's important is they now recognize that faith-based organizations are important. It's a huge operation. There's 7 hospitals involved, over 220 providers and some organizations involved in this, and she is at the leadership table to try to move the dial for the health of our community. Employee engagement, Maggie Keogh. I know our chaplains do a lot of work with our staff. I recognize that, and I appreciate it very, very much, looking at all of you now. This is very important because based upon a grant initially, Maggie started working with having a cart, and what the cart was involved in was to try to help our staff. It's very stressful being on the units. Patients are so sick now in the hospital. So what this program involves is, in addition to the actual cart, there's empathic listening, there's just presence, which we know is so important, group discussion, she offers stress management, she goes out throughout the hospital, and everybody gets an opportunity to have the safe space when she comes to the unit. Maggie's been doing this, and we have data for the past 3 years. For this year alone, 3,150 staff have been touched by the Chi Cart, 27 units at Mount Sinai. I'm not going to share the results because it's going to be a grand rounds, but we did do an employee engagement survey that was developed in conjunction with Press Ganey, which is a very important operation for patient satisfaction and employee engagement, and wow, our employees love this. Not only for themselves, but in terms of how they care for patients. So we're going to roll that out to the system. It's already starting MSBI. And we'll hope to do it at MSL and MSW. It's a program that we want to replicate properly. Senior leadership is very aware of what we're doing. It's extremely important because if employees are cared for, we know they can do better care of patients. Performance improvement research. Von Scharmer is our medical director, and he has done a lot of work in performance improvement prior to coming to working with the center. He also, by the way, is a researcher who's done a lot of work in trauma and child psychiatry. So he comes with that skill set, and I rely on him to help us with the work that we're doing. So the publications that we're most known for now actually is the relationship between chaplain visits and patient satisfaction. That'll be part of a webinar actually for the APC, I apologize. Coming up next week will be a national webinar where Vansh and I will be asked questions. We also now have a recently published article about the differential effects of chaplain visits on patient satisfaction, and right now we're preparing a very interesting article using a very large database of veterans regarding the role of religion and spirituality in their health. So, a database of over 3,000 veterans. We'll share the data once we're closer to publication. But let's say that the data are quite compelling. People who have higher religiosity and spirituality do better. Presentations, we've been lucky to have quite a presence at the HCCN Network Research Program. Actually, last year we had 2 workshops, and one was again on patient satisfaction, and the other one is, where Zarina was very involved, was we explained to them how to engage communities so they could learn from our paradigm. I do want to say upcoming in March, we'll have a plenary session at that program. We've been invited. It's about patient experience. Performance improvement. I was aware that there's concern about on-call, so we did a time study which David arranged, and we have data from the first 3 months. We need to clean it up a little bit so we have a really good idea of what's going on. But I can say one thing, we learned a lot from who goes where. We know that on-call at night is very different from on-call during the day. We have to look more at the data, and we'll share with you once we know. We have a better understanding. We looked again at performance improvement, the role of G-card, employee engagement, and we're involved, and Maggie Key was the point person for this, in an NSICU project regarding resilience and stroke recovery, the critical illness and resilience and spirituality. So, upcoming year. First of all, I just want to say I think we have a great center. You know, red flags. We just have to keep on moving along and take it to the next level. So, given the changing venue of healthcare, we really do need to look at how we place our chaplains. We do a lot of inpatient work, but so much of the work now is outpatient. That MSBI is kind of a paradigm shift already. We need to look at that at our other sites as well to figure out where we need to be. We're going to get more data for call. It will help us for process improvement. I think there's some redundancy of who's on call. There are too many people maybe on call, too much of a burden. We don't need to do that. We need to develop protocols for response to disasters and emergencies. Sadly, we had 2 very big losses this past year in the Mount Sinai Health System of actually a medical student and a physician. And we have to internally determine how we're going to prompt ourselves to respond in an organized fashion, because we're a big system. We have 37,000 employees in the system. Things will happen. We're going to have documentation in PRISM, and we're going to have expansion oversight of volunteers. And Daniel and I have spoken about this. He did a robust program at Northwell. I want to include that here. Education. Our goal is to become the regional hub to train CP students with simulated patients. We're working now with HCCN, Healthcare Chaplain Network, and it looks like there's a possibility. The medical school leadership, including the Dean of Medical Education, is interested in including reflection rounds in 2 of our clerkships. Only 16 medical schools, I believe, have that in the country. Hopefully the 17. And as of yesterday, we decided on, we're going to have a conference in 2017 in November. I think we're ready to do that. Stay tuned for what that will be about. It will be about spirituality and health, and the goal is for a broad audience. Again, I mentioned we're going to do the CHICAR program and measures outcomes in the other system hospitals. For performance improvement, we are about to embark on a project with actually it's the Institute, it's not just a SICU for critical care, Liddell Marcus, on the role of chaplain visits in satisfaction, first with the SICU. There's a lot of important data out there. We want to replicate it. And we are about to start, once the residents get settled in, and the interns are going to do a survey of patients and families with a specific tool for chaplain satisfaction. It's very hard for us to get that data any other way. And we are involved in a protocol for a role of spirituality and coping in oral maxillofacial surgery clinic, and we're looking at other opportunities as well. That's already IRB approved. Community engagement. Zarina is working on finding out what our whole health system needs in terms of community engagement with faith-based and also community-based organizations. So, as you can see, I said a lot, kind of fast. I think we're at a really great point, and I really want to thank everybody. You know,